Hey, this is Dr. Karan from Dr. PK Life again, and today I'm going to talk about a very important topic in this video. This is about common medicine people use for pain, ibuprofen, naproxen, etc. So think popping ibuprofen is harmless, think again. NSAIDs like ibuprofen, naproxen, diclofenac are some of the most overused and misunderstood medication. Today, I'll walk you through 10 serious dangers of NSAIDs you need to know before you take your next doses. So they're called NSAIDs, NSAIDs, or non-steroidal anti-inflammatory drugs. They're everywhere. They reduce pain, fever, inflammation, but if you are not taking them carefully or you're taking them on a long-term basis, some of the side effects may be life-altering or even life-threatening. Number one, let's start with that one. Number one is stomach ulcer and bleeding. Because NSAIDs block prostaglandins that protect the stomach lining, and that results in inflammation, ulceration, bleeding. When I was working in the hospital, every week we'll have somebody with GI bleeding, upper GI bleeding. It was all because of excessive use of NSAIDs. Sometimes people come with acute pain in the abdomen and they have perforation in their stomach. And particularly if they're taking an empty stomach and they combine with alcohol and other medication. So always take NSAIDs with food unless otherwise indicated, and make sure that you tell your doctor that you are taking this medication. Kidney damage. NSAIDs reduce blood flow to your kidneys, and especially older adults or those with diabetes and hypertension, because they always have atherosclerosis, so they already have reduced circulation in their kidney. On top of that, if this medicine is given on high dose and prolonged period, it can cause trouble. So over time, they can lead to chronic kidney disease or even kidney failure. So avoid NSAIDs if you are on diuretics or ACE inhibitors like lisinopril, benazepril, ramipril, things like that. High blood pressure. NSAIDs can cause fluid retention, and that will raise your blood pressure. So you got to be careful because it will reduce the effectiveness of blood pressure medication. Heart attack and stroke risk. Long-term use, especially of high doses, increases the risk of heart attack and stroke, especially with the drugs like diclofenac or Celebrex like COX-2 inhibitors. So avoid NSAIDs if you had a heart attack or have cardiovascular disease. Now, always consult your doctor. Liver damage, though they are rare, NSAIDs can cause liver toxicity if it mixed with alcohol or taken with other liver stressing drugs like Tylenol on high dose more than 2 grams per day. So watch for fatigue, yellow eyes, dark urine, which are the signs of liver damage. Allergic reaction and asthma flares. Some people are sensitive to NSAIDs and can develop hives, facial swelling, life-threatening asthma attack. This is common in people who have nasal polyp or aspirin sensitivity. And if you have allergic symptoms, if you had a history of allergic symptoms, then avoid NSAIDs. Delayed wound healing. NSAIDs block inflammation, but inflammation is also part of healing process. So post-surgery, it should be avoided because it may slow down the tissue repair or may lead to a scar which is uglier or bigger and wider than you expect. Use acetaminophen, that is Tylenol, instead post-surgery. And pregnancy risk. NSAIDs are dangerous in pregnancy, especially after 20 weeks. They can reduce amniotic fluid and cause fetal kidney disease. So pregnant women should avoid NSAIDs unless it's being prescribed by a doctor who is following you very closely. Masking serious illness. NSAIDs reduce fever and inflammation, which might hide signs of serious infection like meningitis, appendicitis. But if the pain or fever persists beyond 48 hours, you should consult your doctor or go to urgent care. Drug interactions. NSAIDs can interfere with blood thinners um, like Eliquis or Coumadin, aspirin, diuretics, ACE inhibitor as well, and SSRI like Prozac, sertraline, Effexor, etc. And potentially can cause internal bleeding, kidney damage, poor blood pressure control. It's always important to tell your doctor what over-the-counter medication you are taking. So in summary, NSAIDs are powerful. They are very helpful. I use it every day on my patient, but I see them on a very regular basis. And this is available over the counter. Sometimes people have chronic, back pain, chronic knee pain, neck pain, and it's commonly used medication. But I usually warn them, let them know that possibility of cumulative damage to a kidney is there. So there is some responsibility. You have to be careful. You have to always discuss with your doctor. Use them for short term, and the lowest effective dose is possible. Start with 400 milligram, can go up to 600. I rarely use 800 milligram. Never assume that just because it's over the counter means it's harmless. So safety tips for NSAID: take with food, limit use 3 to 5 days unless prescribed by a doctor who is following you. Check for drug interactions. You can do it in Google. Avoid if you have kidney, liver, or heart issues. Get regular labs done, particularly renal function if you are taking it for long term. So if you have been taking NSAIDs for weeks or months, stop and rethink. Talk to your doctor about safer long-term option like physical therapy or topical NSAID like diclofenac gel, even herbal alternatives like turmeric and boswellia. If you like this video, share with someone who pops Advil like candy. Follow for more videos which would educate you and make you smarter when it comes to medicine. And this is Dr. Karan from Dr. PK Life, where modern medicine meets ancient wisdom.